hold on, I'm going to stop for a minute.
Okay.
Did I? Oh, I am recording. I'll edit this out. Okay. So hi, everyone. My name is Dr. Annie Ranking, and my friend and I, Mary Beth, who will introduce herself in a minute, thought this might be timely to do some informational short videos about social distancing, since we are all currently social distancing, and that is not something that humans are kind of created to do and thrive in that way. And we both have had many people reach out to us to say, like, we need some insight. So my background is I am a professor in an education department, and in the last few years, I've really been focusing on the impact of trauma for students. And so that's kind of where I'm coming from. Mary Beth.
And I'm Mary Beth, and I am a licensed clinical professional counselor, and I actually also have specialized in trauma in all different types of ranges. So if there's a trauma that you're aware of, you name it, and I have likely worked with it and dealt with it. I also have a background in educational psychology, and so thankfully, during times like this with my own kids, I do have a background in some type of instruction. But one of the things that a lot of people have been asking me about is how to keep a schedule and how to make sure that they're instructing in a way that, maybe that is a little bit more like very trained teachers. And I can't even say I'm a trained teacher, but they're very worried, already stressed about this, and they're very worried about also having their kids fall behind, which right now, like we can't do a whole lot about if that happens. So hopefully my role in this is to help to, number one, normalize some of the stuff that's going on, and maybe give some extra coping skills and give you a little bit of grace.
Absolutely. So one of the things that I want to kind of point out is that some people may not see this as trauma, but when we dive into the definition of trauma, this experience that people all over the country are experiencing of all of the sudden an event happening that is decreasing social interactions, changing our lives, that is a type of trauma. It's not maybe a trauma where you see a car accident or kind of those more extreme traumas, but this is a trauma that does impact our brain. So we'll talk just briefly about that today.
And I'm going to add to what you said. I apologize. I just want to add that another element of trauma that we're not thinking about a lot in this situation, but we need to be thinking about is trauma is what robs us of power and control. And in this situation, most of us have been robbed of power and control, if not all of us. So that does add another element. So just to add that.
Absolutely. And I think that is very important, because I think when we lose power and control, whether we're 5 years old or 50 years old, it sends kind of our sense of self into a mode that we just don't, we react in ways that we don't normally react. And so people around us are reacting in unfamiliar ways. We're reacting in unfamiliar ways, and that can be kind of building in that trauma.
Right. It's a snowball effect.
Absolutely. So one of the things that people often ask me is like, and I'm sure Mary Beth has been asking, or like, I just want the magic solution. Like, just tell me what the magic is to make it all work. And I'm going to tell you there is no magic. So we will be providing you some ideas, some things that are based in research, some things that are based in really great self-care. But there is no magic. You have to take these tools that we'll give you and kind of make it work for yourself. Sometimes it is trial and error. Like Mary Beth and I both said, we have both been in the field of trauma for quite a while, and we are not perfect. I only yelled at my kids once today, right? Like,
wow, that's pretty good.
Right. So it's just like really thinking about how there is no magic solution. Like, we are all kind of being in this together.
Right.
So first, I just wanted to define what social distancing is. So I'm sure that everyone knows what social distancing, what social distancing is, because we have been experiencing it. But basically, you got to stay away from other people and make sure you're keeping kind of good hygiene. I think in Illinois, at least, maybe the whole country, the CDC has said no bigger than groups of 10, and it's just a way to keep people safe from this virus that's currently going around. Mary Beth, do you have anything else for social distancing?
No, I think you covered a lot of that.
Okay. Do you want to talk about isolation?
Do I want to?
Yeah.
I would love to. Or did you say I do want to, or do I want to?
Do you
Sorry.
want to? You
I
go
would
for
love
it.
to.
Talk about isolation. No, you're good.
Isolation is something that I actually handle a lot in my field of business. A lot of people that come to me do experience, or actually a lot of times are trying to move away from isolation. And in this circumstance, we're kind of being counterintuitive and saying, no, we want you to isolate, which is totally against human nature. So, so by definition, what Annie talked about, it's being far away from other places, buildings, or people, and being remote. A lot of people do prefer some isolation in their lives. You can tell that by where they choose to live, et cetera, et cetera. But a lot of people by nature do not prefer this. And so when we talk about this on the slide here, it talks about whether or not you're an introvert or an extrovert. We all do require connection with others. That is part of what makes us human. And so while some of us really thrive on the energy of other people, so some of us really gravitate toward big events and functions with a lot of people, others might do really well in this kind of a situation because that is a draining situation for them to be in groups of people around a lot of places. And so some people are faring pretty well with this, while others are now feel like they may be being drained emotionally because they don't have other people's energy to feed off of. And if you are one of those people and you are sitting at home and you are with your kids or your spouse or your parents or whoever that you love, you might actually also feel a sense of guilt that comes along with feeling drained because you're not getting the energy from the from the interactions that you normally are getting. Try to understand that that is just possibly the way your brain is wired. That has nothing to do with how much you love and appreciate your loved ones that you live with. What makes this difficult for a lot of people there are people that are living alone, and work and school, et cetera, are places where they do get those social interactions. And so for those who are living all the way alone, it's important to reach out even more than anybody else. Why I already mentioned this. Annie, do you have anything to add so far? I don't want to monopolize this slide.
No, you go for it.
So the way that this is laid out is really, really perfect. Why I mentioned why I mentioned at the beginning that I work with a lot of people who socially isolate is because, like I said before, I'm usually trying to help them gravitate away from social isolation, because social isolation is very, very correlated with a decrease in mental or brain and emotional health. So that puts you at risk for depression, cognitive decline. So when you see the word cognitive, you're going to think the word thought. So the decline in thought, sometimes speed, sometimes how much sense you're making to yourself, and so on and so forth. It does increase anxiety for many people, and all those things put together, if you are prone to substance use and substance abuse, it does put you at risk for that. So for those of my friends who are in the substance use disorder recovery world, please be extra safe with yourself. Please be extra careful with yourself, and try to get online meetings, or talk to your support group, because this is a very trying time for a lot of people in recovery. In elderly individuals, it talks about how it's associated with increased risk for dementia. And it also, of course, is an increased risk for anxiety for elderly individuals, and depression. But the anxiety comes from, a lot of elderly individuals do have caretakers that are younger that are normally dropping by, and now they may not have access to that resource. They don't know when their next meal might come, and hopefully they're in communities where people are able to somehow provide that to them. But it can really decline fast. And so we'll talk about the elderly population and how they can help themselves through this, and maybe how you can help them through this from afar.
Excellent.
Anything to add?
No, that was great. Yeah.
Okay.
I just want to put a note in. So people who are watching this, we have put this together in like an hour. So this is very laid back, maybe even less than an hour. But Mary Beth, I just want to make sure that when we get to the self-care part, we talk about telecounseling.
Yeah.
Because that's something that's super important. So one of the things that is really important to remember is that humans are designed to have connections. So it's important in maintaining our health, our brain health, our physical health, to have connections. So I know that in the past few days, many people have had connections the way that Mary Beth and I are, through Zoom or through other modes of communication like that. And I have had multiple meetings this way before this social isolation, but I was still able to go to coffee shops and do it. And kind of the interactions with maybe people that I wasn't actually interacting with, but that were just around, and I could feel their energy. When you're social isolating, or you're social distancing and are at home, and are mandated to be at home, essentially, the idea of human connection isn't the same when you are doing a Zoom meeting.
Mm-hmm.
You want to make sure that you're continuing that social isolation, but doing things that are still connecting you to humans in a way that is productive to your own brain health and physical health. Mary Beth, do you have more to say on that?
No, and actually, well, one thing is a lot of people are not callers anymore; they're more texters. And so, if you're able, that voice, that tone of voice, all the things that come along with the face-to-face interaction, if you're able to replicate that in any way via FaceTime or even Marco Polo or just a phone call, that is more beneficial than texting, because texting, you don't know when you're going to get the response necessarily, and you can't hear tone of voice, and it just does not feel as personal. And so for those of us who are callers, which Annie can attest to the fact that I'm a caller, it's not as big of an adjustment. For those who are texters, do not be afraid that if you call someone, they are going to feel annoyed by it. At this point, they need it as much as you do.
I think that's a perfect point. So I have FaceTimed more people and called more people in the last 24 hours than I probably have in the last 6 months. And just because I want them to see that I'm smiling at them, and that I'm encouraging them, and I'm there for them, and I'm that support. So I think that is super important, because I am a texter and Mary Beth is a caller. And so when you have those types of friendships, it's balancing it. But I think having those callers during this time is really important. So then, talking about trauma. So some people may not see this social distancing as a type of trauma, but this is a deeply distressing situation and experience for people, for us, for parents who have or caregivers who have children at home 24 hours a day, 7 days a week, feeling as they need to be educating them, feeling as though they also need to be working, having everything in one place and still having full-time everything else, feeling like you need to work full-time, do school full-time, all of that. So there are different types of trauma. You can see them listed here. There's acute, chronic, complex, and then secondary or vicarious trauma. And this is just kind of for your information. Not knowing kind of how this is all going to play out. We don't know kind of what type of trauma this will end up being for many people. But what's also important to know is that trauma impacts people very, very differently.
Right.
The same event, just within my household, has impacted me much differently than it has impacted my husband. My husband is still required to go into work, but I'm not, and so I'm at home with our children. And just that experience of social distancing, but coming home and me being at home all day, kind of feeling like stuck in the house, like those are different types of experiences, but still a type of trauma that we are experiencing in different ways.
Right. And that is the same to be true, excuse me, with your social network. So while we are all experiencing the same event at the same time, this event is different for many of us. So I'm going to give an example how it might be different from one family than the other. This is also someone, actually, I would say 3 or 4 people tonight have reached out to me about the social distancing and what it means to their family. And so if it's okay, I want to go into, you may be, someone out there may be in a family that is comprised of people that are very low risk for COVID-19, and others are in a family where they have to be very delicate and make very conscious decisions about how frequently they do leave the house, because when they come home, it's a really big risk for people. So one of the things that we need to remember when we're seeing things on social media, when we're talking to family and friends, that my experience might be worlds different in the same situation, might be worlds different in a health risk way than my peers or my family members. And so if someone is expressing, hey, please don't come into my house, please stay 6 feet away, I know you're the grandma, and I know you want a hug and a kiss from your grandkids, but he's got a sickle cell, or she's got asthma and I can't do it. We have to be okay with the fact that we're all in different risk factors, even if it doesn't look like it on the outside. We do know that this affects some people differently than the others, and we do know the risk groups, but sometimes we're not as cognizant of who might be in that risk group. If like an elderly person isn't living in my house, people might just think my family does not have a risk, which is untrue technically in my family. So be very aware and proceed with caution. So err on the side of caution. If you are normally like a hugger and a handshaker and a physical touch person, and even if that other family is too, think about maybe before you do that anyway, think about their possible health risks that you might know about. And I would say, if you shouldn't be doing that because it's a 6-foot rule, but if you're in that kind of intimate relationship, you need to ask the responsible adult in that family, or you need to ask them, is it okay if I give you a hug? Are you going to be, is this a very risky thing for you? Err on the side of caution.
Absolutely. And I think that goes into the idea of people's perception and experiences with trauma. We're all experiencing it in different ways. And so it's something else that has come into play before kind of the mandates to kind of close down bars and restaurants in Illinois, was that joking about like seeing, so I am in schools a lot, so I would see kids joking about like, oh, I touched you, you have the COVID-19 now.
Right.
And it's not really a joking matter for many, many people.
Right.
So making sure, like, while that might be one of the ways that you cope
right
with situations, also being cognizant of that can be very offensive to some people.
Right.
When we're already at high levels of stress, let's just be cognizant of people and kind of think before we talk.
Right. And I'll be honest with you, I am a very humor oriented person, and I have noticed myself, I've had a couple foot in my mouth experiences recently and biting my tongue. And so if you catch yourself doing that, just acknowledge it. Give credit where it's due, like probably not the right time for humor, or I'm really sorry, I understand that might have been a little bit offensive there.
Right.
Sometimes humor is a good thing, but you got to be careful what it is.
Absolutely. So I want to dive into the brain for just a little bit, just so we can understand what's happening. So as I've been talking to people, what I've been trying to coach people, so not only am I a professor, but I'm an educational and learning coach. And so I've been in a lot of buildings working with teachers as they're trying to move to e-learning and trying to handle this new transition for educators. And I keep telling people, like, everyone is in their survival brain right now. Everyone is at the point where they are just fight, flight, or freeze. And so their reactions are much, much different. And so here are two pictures of kind of what I'm talking about. So the survival brain is at the back of your head where you can see the arrow, and that's really kind of your like reptilian brain, or your where you go for your instincts. And so that is your fight, flight, or freeze. And then that green part is your smart brain, or your prefrontal cortex. And if your survival brain is completely functioning, then your smart brain can function. But if your hormones, if your emotional brain or your hormones are, your stress hormones essentially are firing off, then you do what's down in this right-hand corner and your lid is flipping. So that basically means your brain doesn't actually flip, but that basically means your smart brain, your prefrontal cortex, is no longer attached, quote unquote, attached to your survival brain. And so your brain is completely in survival mode. So that's why we're getting different reactions from people that have reactions normally. That's why we're having maybe more confrontations than maybe you normally have. That's maybe why when you look back at what you did 24 hours ago, you think, man, that was not the best idea. That's because you're completely, many people right now, because of the high stress, is completely in survival mode. Because of the lack of control, and just all of the stress hormones that are kind of pumping into our bodies right now.
Yep.
Beth?
You nailed it.
So we're going to dive into self-care. And I just want to say that one of the things that I really talk about often is this famous quote. This one says, it's by a man named Brandy. I've seen it by Gwyneth Paltrow. It's really just saying, like, you need to put on your oxygen mask before you can assist others. So if you have elderly parents that you need to take care of, it's really important that you have self-care for yourself before you can go and help them with what they need. Again, going back to the idea of you're in your stress brain, your survival brain. If you have children that you are at home with much more often than you normally are, just make sure that you're really, really taking care of yourself. And so the definition of self-care is the practice of taking action to preserve or improve one's health. And that's both physical and brain health. So it's important to really kind of take care of yourself. And so these next few slides, I'm going to kind of throw over to Mary Beth so she can talk about those self-care practices that she talks about in her therapy practice.
Yeah. So, so Annie developed this, the actual PowerPoint. I added to it later. And when I looked at it, I was like, that first one, that would have been my first one too, schedule. So many of us have lost what we consider to be our own routine. That is such a huge deal. And while it is good to take breaks from a schedule and take breaks from a routine, when we're thrown into it, it's good to start with a schedule for a lot of people instead of just not knowing what to do. Scheduling does a couple things. The first thing is you know what to expect. And knowing what to expect helps with in a time of trauma and crisis, because again, it takes that power and control away from you. So scheduling not only gives you what to expect, and gives you like ability to predict things, because right now our world is unpredictable. It also gives us that sense of power and control. Scheduling also, if you're working with kids or even people who are in who have developmental disability or those who are older adults, scheduling is important for them just as much as it is for anybody else. So it can actually help to keep them in some type of routine. Routines can give parents and caregivers breaks. And so you can schedule breaks into your day, and it's wonderful. Taking deep breaths is a really common one. Taking deep breaths does a lot of things for our body. I want to remind people, anytime that anxiety is involved, it feels in your body. If you think of all the symptoms that come with anxiety physically, it feels very much like the same as anger and fear. So anxiety is a derivative of fear. It comes from the fear response. But so if you are someone who has been accused ever of having a really short fuse, you might, if you look back at times when you're like, why did I even blow up about that? I wasn't even mad. It was likely that you might have been anxious during that time. So in our bodies, when we are anxious, our breaths are shorter, our chest feels tight, we might be sweating, we might be hot, our blood pressure does increase, and we could be shaky and sweaty and all those things. And so when we take those deep breaths, we're controlling how quickly our breath is. And then it slows our heart rate down. It decreases our blood pressure. It allows our logic brain. Is that what you were calling it? The logic brain?
Your smart brain or your logic brain. Yeah.
Yeah. I call it logic brain or reasoning brain. It allows that to start to kind of be like, oh yeah, I have some control over some things, and we can then respond instead of react. So if you're noticing that your fuse is short, deep breaths can help. Deep breaths aren't always for everyone, but across the board, if you have not experienced breathing traumas, so where you have not been able to breathe, or you've had a physical injury to your body or chest, most of the time, deep breaths will really, really help. If you have had those types of traumas before, you've likely worked through some of the different strategies behind that. And that doesn't have to be deep. It just can be mindful breathing, where you're paying attention to the pace of your breath. Instead of breathing in deep, you can pay attention to the pace and slow breathe, which is different than deep breathing. On here, I put give yourself grace. That is something I say to my clients a lot. I say it to myself a lot. I say it to my family and friends. We are not to be compared with perfect, because none of us are going to be. And especially in a time where we don't have a lot of practice, I'm sure everyone's heard the term practice makes perfection, and really practice makes progress. And so we are all brand new in this experience because we've never been in a pandemic before. So make sure you're remembering that, like, this is not normal yet for you. You will have a new normal, but you got to give yourself some grace. And when you're feeling down on yourself, or you're feeling guilty for doing self-care, which is different than being selfish, then remember, I need more practice at this. It will get easier with practice. Taking breaks is essential, and I mentioned that during schedule. If you have to take a break, take a break. If that means, for parents, if that means your kids get extra screen time, like, this is the time to do that, if any. So make sure that you're able to take your own breaks, so that when you are with your loved ones, you can actually be present with them, which is so helpful to their psyche, which will be then in turn helpful to yours. And then know your limit and be okay with it. Yeah.
Mary Beth, I was going to say something about take a break. So it goes back to that putting your oxygen mask on before your kids, because when they feel your anxiety, when they can sense what's happening in a household, in a room, they can sense that. And so if you feel yourself getting to that point, take a break. Like,
Yes.
not in the schedule, just say, like, we need a 5-minute break. Everybody needs to go to their corner or whatever it is. So making sure you're aware of that.
Right. And I do want to say, not all kids, I also wanted, I talked about this yesterday on my page. Not all parents right now are parents of active speaking kids, if that makes sense. So
Right.
we do have a lot of new parents in this world right now that are struggling already with the change of pace and change of everything from having children, a baby. Some may be struggling with postpartum depression, postpartum anxiety and mood disorders, postpartum OCD. And then on top of that, now we've got this trauma. So what I want to make sure that people know, if you are that new parent, call someone, take a break, put the baby in the crib and walk out of your house for a moment. It's okay if the baby cries because you need a break, because right now you're not getting as much help as a lot of other people got when they first had babies. And if you need help, someone is there to help you. So I can give Annie some links for that kind of stuff too. So just if you're struggling with that, for any of that, reach out.
Perfect. And then I thought this might be a good place also to talk about counseling for self-care, because I know, so my mom is a minister by trade, and she oversees many ministers. And tonight we were talking about how she is really going to encourage her ministers who are ministers, nurses, doctors, kind of the people on the front line. Counselors, therapists really need to make sure that they are not, that they're taking care of themselves also. But any parent who or caregiver who feels like they need to be taking care of themselves, that there is the option of telecounseling.
Mm-hmm. Yeah. And so right now, there are so Medicaid and Medicare, if you've got those right now, the restrictions have been lifted for telehealth in general, including telemental health, teletherapy. Most private insurances have jumped on board with that as well. There used to be a lot of restrictions, and there will be again. But for now, and there should be, I get it. But right now we're in different times and uncharted territory. So they're lifting a lot of the restrictions. There are a couple insurance companies that are still kind of iffy about it, but we do believe and we do think that in the very near future, all insurances will cover teletherapy. And so at least during this time. this does a couple of things. Number one, it allows for us to practice social distancing so that we are not, we therapists aren't risking the health of our clients, because that is the last thing I want to do. And likewise, you know, we are also human with our own human families. And so we're trying to minimize risk for our own families. And so if I'm able to give a therapy session without sitting there wondering, where has this person been? Are they in the hospital? Are they on the front lines? Have they, you know, come in contact with someone? I'm in that therapy moment, not able to be present for my clients. And so for this purpose, it is really important for we therapists to be able to do some teletherapy, because that means that you are going to get better care than if we are worried about our own bodies and health as well. So teletherapy is a great option. It functions a lot like what we are doing right now. You would see someone like me or whatever therapist on a computer or a phone. It's not hard. It's HIPAA secure, meaning people aren't able to break in just as secure as like an encrypted email. Okay. And so it is private. It is per our regulation and our ethics. We have to do that in a private place. I'm still fortunate enough to be able to travel to my place, my office, because it's just me there. I don't have any risk there. And so you get the same privacy on telehealth with many therapists as you would you know, any other time. Some therapists are doing that out of their home. And in order to do that, they take a lot of privacy measures with sound machines, making sure they're in a remote area, making sure nobody's in listening distance. They wouldn't be in the same room. So it is a secure thing. And if for whatever reason a therapist is nervous that security within their own home may be an issue, they would stop the session and say, I'm going to need to tap back in a little bit because I have to make sure no one's coming, you know, whatever. I haven't heard that have to happen yet, but we're all trying to get to everybody who needs to be, you know, talked to.
Right. It's so important at this time, I feel like also,
Mhm.
with all of this stuff that we've been talking about today.
Yeah.
So the individual care, I think a lot of this is similar. Making sure you take care of yourself. If you are a normal person who works out, making sure you're working out. The schedule, the gratitude, I think, is very similar to give yourself grace. We can talk about that also. So the meditation, that's something that kind of goes along with the deep breaths. Meditation doesn't need to be something that is stringent and strict. It can be sitting in a chair for a minute and taking really good deep breaths in through your nose and out through your mouth. And really what the idea of meditation is to really think about what's happening around you. So naming 3 or 5 things that you hear, naming 3 to 5 things that you can smell, 3 to 5 things that you can touch. So like really bringing in those senses.
Yeah, that's what we call grounding. So,
Yes, so it's
so if you
very
have a
much
hard
like
time
grounding.
all the time, I'm so glad you mentioned that, because I was going to if you didn't. It's a wonderful tool. It just brings you back to the here and now if you're
Right.
anxious. Mm-hmm.
And so so it's not thinking about the future. It's not thinking about what am I going to do a week from now if they're still
Mm-hmm.
school. It just brings you right here. It doesn't put you into that future mindset. It brings you right here. The going outside I'm going to talk about, and then I'll let Mary Beth, and the gratitude, and then I'll let Mary Beth talk about the last couple of them. So going outside, there are a lot of benefits to going outside. Much like the breathing, it brings down your, it kind of regulates your heart rate, brings it back down if it's kind of accelerated. It decreases the stress hormones. It decreases your blood pressure. It really is just a really great way to kind of breathe in the outside air. And one of the things that I often tell my teachers who are in high stress situations, and I don't know if now would be the best time because it's kind of cold out, is but if you take your shoes off and just put your feet in the grass,
Mm-hmm.
there is really like a connection that you can have with the earth and with nature that can really kind of recenter your body. And so really just kind of making sure that you're doing that. And then the gratitude part, that is something that has been, I would say, a trend the last few years, but really just in the morning, waking up and saying 3 things that you're grateful for, those gratitudes. And then before you go to bed, just having those 3 things that you are grateful for. And that really, again, kind of recenters your mind into the positive. because when our stress hormones take over, we often get into the pessimistic negativity, and we want to just make sure that we're starting our day on a positive note and we're ending our day on a positive note.
Yeah, and for these purposes, your day may seem a little monotonous. And so even something as small as no news is good news. And, this was uneventful today. Boring and uneventful kind of go hand in hand, but in a time like this, boring is a welcomed feeling, even if we may not recognize that and if that's not normally our thing. So yeah, absolutely.
Do you want to talk about those last few that you added on?
Sure. You had talked about the link to others very well before, so I'm not going to really get into that. And also the leisure activities and games does go along with like going outside. So leisure activity is an activity that is for the whole purpose of the activity is just enjoyment. It doesn't have to be finished all the time. It's literally to do something you enjoy. You can read, you can cross stitch, you could play a video games and leisure are often tied together. And with leisure, there's no rules necessarily of like how to do it, what's right, if it's done correctly. Whereas, with games, there are rules and guidelines and things like that. And both of those also help increase, dopamine, serotonin, and all the happy hormones that we have. And so we want to make sure that we are doing those things. If one of those things is something that you don't get a chance to do often when you are working or when you're teaching or when any other time when you're out running errands all the time, try to tap into that now. Leisure can also be, or excuse me, those types of activities can also serve a function if you choose for it to. I enjoy cooking. I don't always like cooking, if that makes sense. So when I don't like cooking is when I'm in a rush when I get home from work. If I haven't already planned it out, it doesn't work right. Well, now I can kind of, experiment more in the kitchen to a degree with limited supplies. But those types of elements of our life are less rushed right now if you are one of the fortunate ones like me who has a little bit more time at home. So those of you who are still working and in the trenches and out in the real world, make sure you are certainly allowing yourself time for leisure activities and games, because you are not only stressed from probably like a healthcare or first responder, restaurant industry type, even though the restaurants are closed or not closed, those types of fields where you're serving others all the time. Those are all service fields. You need that even more than the people who are sitting at home all day. So make sure that you know that if someone's waiting for you to get home, you let them know ahead of time, I need 20 minutes by myself, or I'm going to drive around for 20 extra minutes because I have to decompress and I need to listen to music or whatever. The last one on there are vision boards and positive future thinking and daydreaming. So when I put positive future thinking and daydreaming, I meant that. That's the sunshine and rainbows thing. Annie talked about in the grounding techniques, not thinking about the future, which is most of the time in these scenarios, it's good to not think about the futures because there's a lot of what ifs. But in vision boarding, meaning like it's like a poster board where you pretty much do a collage of magazine things of this is what I want my life to look like. That's what we're doing. We're focusing on when this is all over and I bounce back in whatever capacity I'm able to bounce back. These are my goals. This is a great tool to use for your kids as well, because they're going to get stir crazy. They're going to feel like this is never going to end because we can't give them a timeline, which is scary. So if we're taking care of ourselves by doing that, we're also then modeling that same mindset, like this is not forever, because if it were forever, I would not be thinking about the future in a positive way. So we're modeling that to our loved ones too.
That's a perfect idea. I like that idea. That's great.
Thank you.
And so then, since I am an educator, and we know that teachers are being kind of thrown off, especially teachers who are not used to virtual teaching, teachers who are not used to homeschooling, parents who are not used to homeschooling, making sure you have connections. You need to connect. You need to see people's faces. You need to do those types of things, connecting with students, especially any student, but especially students whose parents may still be working and they're home by themselves. Students who you may be worried about during a normal school year, and now they're home. I know many communities, including the one that Mary Beth and I are in, are providing meals, but students have to get to those meals. And so making sure to be thinking about how if those students that you're worried about are not showing up to getting those lunches, figuring out how you can make those connections and really support your students. And that, I think you added those last two, right? Or
I did, and I have a total misspelling, I believe. So I'm giving myself grace because we did throw this together pretty quick.
We did.
Acceptance, essentially, like this is your new normal right now. And teaching is a stressful job. I chose not to stay anywhere near that field, not near that field, but I don't need 30 10-year-olds around me at all times. So I praise all of you for doing that. And what this has really reminded me of is the love that the teachers that choose this service field with children have for their children. I am connected with so many teachers. My dad was a teacher and an administrator later. My grandfather, my grandmother, my aunts, like you name, that's my family. And I think that's how Dr. Ranking's family also is
Yep.
kind of such. I've always known the love for teachers that teachers have for their kids, but seeing the concern that my friends who are teachers are having for their students, it's heartwarming. It tears me up, to be honest with you. What's hard about that you guys worry so much about the kids, and even if they get on your nerves, you worry about them because those are your babies, no different than a parent would. And so finding ways to accept that you were thrown into this, you did not abandon them, and that this is something that you get to grieve as well, that you are going through at least as much as some of the kids that are now not with you. I know that we are all very aware that some of the kids are in dangerous situations at home, not even just related to food, but with abuse and things of that nature. And unfortunately, for now, when they're not in your loving arms, we can't control that. One of the things, to a degree, we really can't. So one of the things that you can do is just remind yourself, they know I didn't leave them. They know I'm here and I'm a whisper away when they need me. They have ways to somehow reach me. And if they don't, we will just hug it out when we get back. A lot of my teacher friends are also worried about the academic success of their students. Everyone's stopped right now in Illinois. No one's getting an education right now besides what their parents are able to provide. And I'm going to be really honest. I'm able to provide a pretty decent education to my kids, but do I have the time in this moment in my life right now? I don't. So even my kids with an educated or an education oriented brain, they're not getting the same education as they would get with you anyway. And that's concerning, right? And so it's okay though. I will give my kids the best education I can possibly do from home, but I'm certainly not you. I'm not a teacher. That's just not who I am. I chose not to do it, and I chose not to homeschool. But I don't want you to worry about their academic success at this point. They will catch up. You catch them up every year after summer break. You do it. It's magic how it happens. And so that is one thing I want to stress is while you can provide them everything you can provide them with, and while their teacher or their parents can do the best that they can with what they know, that's the limit that we have right now. That's all that we can do. And so, but you don't need to worry about, oh my gosh, but this other school, none of them are. We can't. So we're just where we're at. And next year, if the kid is in third grade, he and his class, just like his peers from another district, are going to have to start from an earlier, a lesser, what would that be? Like an easier
like
point.
a younger grade. Like they may need to do more review than normal.
Yeah, their zone of proximal development isn't where it needs to be. Like you're going to have to bump them up. And you know what? Who better to do that? And they will feel so proud when they reach those milestones. So one of the things that you can do is know that you can, when this all settles down, you can provide bridge work for the summer. You can give these access to resources. And we have a lot of it now that we didn't have free access to before. So hang in there. We know that your heart is broken right now. And we see that, and we see the love that you have for our kids.
Absolutely.
Sorry for that soapbox.
No, I think that was great. So this is Mary Beth's information. This is my information. If you have questions, you need support, you need tips. If this goes well, if people enjoy these videos, Mary Beth and I could continue them if there's specific questions. I have a feeling this is going to go longer than the 2 weeks,
Yeah.
but who knows, I could be wrong. One of the last things I want to say before we end, and then I'll see if Mary Beth has anything to say, is you really want to make sure that if you're a teacher who's sending videos, if you're a parent or caregiver around your students, you want, as an educator, you want them to know you miss them, but you also want to stay positive. As a parent, you really need to stay positive. You don't want them to hear you saying, I can't deal with these kids anymore. You know, like those types of kind of negative comments that you may be thinking and you may want to tell a significant other or a friend. You just really need to make sure that your children aren't hearing that, because it can really it can have negative consequences for their sense of self-worth, their self-esteem, their stress levels. They're stressed also. I mean, like that can really impact. So just again, being very cognizant of the words and the comments that you're saying around your children.
That said, you can still be assertive with your children, and when you need a break, you can say it, but don't put it on them. A good thing to say is, I have a lot that I'm thinking about right now, and I kind of do better by myself when I think about those things. I'm going to set the timer for 10 minutes. If you really need something, I'm here for you, but I just want to be all the way here for you, and my brain is really working hard right now. The best thing when you need to do that, it's hard to do in that moment, but if you've got young kids in particular, get an activity that they like, Play-Doh, coloring, whatever, that they can focus on for a few minutes at a time and say, mommy has got some things to do. And that might be literally walking into the garage and like sitting there. Doesn't matter. Like, I have to go check on something in the car. Here's some Play-Doh. Can you please draw me a picture of blah, blah, blah. So express when you need a break to your kids, but like Annie said, don't put it on them.
Yeah. Excellent. So I hope that this was helpful for everyone. Again, if this goes well, we can continue this. If this is a one-shot deal, that's okay. Also, just wanted to make sure that we got some of this information out for people who were asking both of us about it. And so I felt like this was a good video that we could support each other in.
Yeah, thank you for even coming up with this, Annie, because I was like, I don't know what to do. And by chance, you sent me a text and I'm like, perfect, this is great.
Right, and literally maybe an hour and a half ago. So you guys got it fresh off. Awesome.